Thank you, sir. First on the agenda is Mrs. Amanda Maggard. She is the CEO of AdventHealth Zephyrhills Dade City. Amanda Maggard serves as the president and CEO of AdventHealth Zephyrhills and AdventHealth Dade City. Amanda has served for more than 15 years with AdventHealth, one of the largest nonprofit health systems in the country. Her background includes experience in hospital operations, organizational development, marketing, and fundraising. Amanda is passionate about crafting a mission-driven culture and pursuing excellence in patient care. Amanda is a fellow of the American College of Health Executives. She has undergraduate degrees in journalism and marketing and a master's in business administration. In 2015, she was named by the Orlando Business Journal as one of Central Florida's 40 under 40. Amanda and her husband, Michael, have two young sons, Griffin and Landry. Mrs. Amanda Maggard.
Well, good morning, everyone. It's great to be here. Great to actually get to see some people and do it safely. So I'm taking my mask off because I'm far enough away. Will this allow me to click through? Okay, perfect. Okay, great. So I have to just share, today is a really special day because it's our oldest son's birthday today. So if I have a little extra smile, it's because we got to wake him up. He's 7 years old today. So anyway, got to remember those special moments of life. It has definitely been an interesting year, hasn't it? 2020 is a year I don't think we will soon forget. With that being said, though, I want to share with you some of how our hospitals have responded, and also want to thank you and our community members for how you have responded and helped to support us through this time. So here's a glimpse of some of our team members in front of our hospital here in Zephyrhills. It was back in March that we started to hear a lot more about COVID and what impact it was going to have. And as you probably know, our two hospitals are part of AdventHealth, which is one of the nation's largest non-for-profit healthcare systems. We have over 50 hospitals in the country, and our corporate headquarters is in Orlando. And so very quickly, when COVID started to spread and there was cases in the United States, our company president said, we need to pull together and work together on this as one big team, pull all of our resources into this response. And so our company initiated a system command center there in Orlando, which I was asked to participate in. And what that did is it helped us pull our best experts in clinical thinking. It helped give focus for our supply chain leaders. Our company president very quickly said, forget about your strategic goals for right now. You need to focus first and foremost on serving your communities and keeping people safe, and finding out what this COVID is and how we can best protect our patients and our team members. And that was so refreshing. It very quickly gave us the focus that we needed to be able to go out and accomplish this unknown and daunting task ahead of us. The other thing that I was really proud of and thankful for is he said we need to go out and secure as much personal protective equipment as we can. We have had a lot of personal protective equipment to serve, but COVID really escalated the amount and types of PPE that we needed. And very early on, we've been learning every day and every week and every month new things, because this has been an unknown virus, about what types of equipment to use, when and which situations to use them in. And so that guidance has changed. As the science has changed and evolved and we've learned more, we've had to be nimble and adaptive and make those changes daily and weekly, which has been tiring for our team for sure. But one of the things I was appreciative for is that AdventHealth, our president, said we're going to go out, and basically he told our supply chain team, you have a blank check to secure as much PPE as we need to keep our team members and our patients safe. So that was a big focus for us early on, is pulling together as one large system team, using our top minds from a clinical perspective to figure out how can we best treat this virus, and going out and securing the resources that we need and sharing those amongst the system, so that it wasn't one hospital or two hospitals on their own, but it was really one large system overall working together. There's a few other things I'm really proud of that AdventHealth has done, and I want to share those in a bit. But first, I want to say thank you to our community. There's some pictures here that show how you all really rallied around our team, and that energized them When they saw you doing drive-thrus, delivering free meals and sending notes of encouragement. I've gotten so many notes of encouragement from folks in the community. Our team members have gotten those, and that has really meant a lot for them. As they've had to wrestle through their own personal fear and anxiety, or what they might expose their loved ones to, as we've learned this virus. And so thank you to all of you for the support that you have shown our team throughout these last few months. So I'm really proud of how AdventHealth responded in this crisis. This slide, I know these bullet points are going to be hard to read, but this articulates some of the things that we have done for our team members throughout this time. AdventHealth was one of the only healthcare systems in the country that did not lay employees off. There were several months where we had to stop many elective procedures and surgeries and things like outpatient physical therapy. We did not, during that time throughout AdventHealth, lay employees off. What we did instead is AdventHealth committed to continuing to pay those employees their full-time wages through the beginning of June as we navigated this unknown time, and we redeployed them. So we started doing temperature checks and providing childcare and a number of different things. So we asked those team members instead to be redeployed. We had some of our physical therapy team that were serving in our cafeteria, helping alongside nutritional services. Our wellness center team helped in a number of areas, including temperature checks and putting on activities for our team members to help them know how much that we loved and cared about them. Including setting up a dunk tank outside of the hospitals, which, yes, I did get dunked a few times, and I live to tell the story. And I could tell you which of our nurse managers have the best arm. But there was a number of things that we did, like continuing that pay. AdventHealth also provided lodging. So if we had employees who were exposed, potentially we paid for hotel rooms if they wanted to stay in a hotel away from their families and not potentially bring that back. We had childcare that was available. We had mental and emotional support, and we continue to offer that for the team. So I'm really proud to be part of this organization that committed so much to helping to take care of our team members and our communities during this time. I wanted to share with you all as well a story. So this comes right here from our own hospital in Zephyrhills, from our intensive care unit. And this story was selected and shared. You'll see here in a minute, the AdventHealth president, Terry Shaw, he shared this with all of the executives in the company.
Stories that have come out of our own caregivers and the work that they have done over the past 5 months dealing with COVID. And it is, and it's just, it is amazing to me how many people work for us that actually run towards the fire as opposed to away from the fire. And I think I'll get through this, but I have it written out so I get it right and so that I say it right, and I'm going to read it to you. But this is a story from AdventHealth Zephyrhills. Sometimes it's a big effort and really going all out to ensure things happen the way they're supposed to. And this is Joe Kennard, who's the Director of Intensive Services at AdventHealth Zephyrhills, sent this in. I have a person that works for me. His name is Jason Wright. He volunteered to care for one of our first severe COVID-19 patients we had at AdventHealth Zephyrhills. Jason explained to me that the reason he requested this patient is that he lives alone and he has no one to pass the pathogen to. Jason worked with this patient for 6 straight days to limit the exposure of everybody else on his team. As the patient's condition worsened, the family wanted a priest to perform the anointing of the sick, but the clergy could not come to the bedside. Jason asked for instructions. He learned the prayer, he obtained the sacred oil, and he performed the anointing of the sick himself. And what's worse than telling half a story is not having the other half with me. At the end, he promised the patient's wife, who could not come to the bedside because she was at home and sick and quarantined herself, that her husband would not die alone, and he kept that promise. The patient passed peacefully and with dignity as Jason held his hand and talked to him. Then Jason completed the post-mortem care of the patient single-handedly to further ensure the safety of everybody that he works with. Jason is an amazing person. He's an example of how adversity can bring out the best in humanity. The acts of courage and loving compassion are deep ones. Jason is an example of the power of human spirit and the power of people who run to a problem and not away from a problem. They show up every day to extend the healing ministry of Christ and to live out our service standards of helping others, even in the worst of times. I pray that everybody is like this young man. And I pray that when we impact the lives of one other person, represent what this person does with everyone we come in contact with as well. Thank you very much for what you do. Thank you for the care, love, and concern you have for your teammates. And thank you for the love, care, and concern your teammates have for those that we care for. Blessings to each one of you, and we'll see you soon.
Because it's such a heartwarming story, and I'm so proud of the work that our team has done during this time. So we are continuing to work to keep our team safe, to keep you as a community and our patients safe. Here's some of the things that we're continuing to do in the hospital. We have markers around to make sure that folks are keeping that social distance. We check the temperatures and screen anyone and everyone who's coming into our facility every single day, visitors, patients, physicians, our team members. We have masks available, and we require masks to be worn in the hospital, as well as extra cleaning that we're doing throughout the whole facility. I didn't list it here, but we are also continuing to learn and apply the latest clinical evidence-based best practices. So we're taking lessons from all of AdventHealth and around the country and trying to apply those to make sure that we're giving the best possible care to patients with COVID. We have remdesivir that we are giving it at the hospital. We've done convalescent plasma therapy and a number of other treatments as we continue to learn and evolve, and do see the treatments improving. We actively monitor the volumes of COVID throughout our hospital. This graph here is hard to read, but what this shows is a system-wide view trending the number of COVID patients throughout our regions. The top number there shows all the COVID patients in our Central Florida region, which is the largest region in our system. The yellow line shows West Florida, all of our hospitals in the West Florida division. You can see some of the other lines there from our hospitals in the Midwest and the Southwest. As we just continue to monitor. We locally here saw our biggest surge in mid-July, was our highest numbers. It's declined since then. We saw a little bump up recently, and just kind of watching to see if that's just a small little wave and it reduces. But the point is that we actively watch and monitor what our volumes are and adjusting. We also keep patients who are COVID positive or suspected of being COVID positive. We cohort them in a separate space and keep them away from other patients to try to keep everyone safe, as well as our teams. So what can you do to help prevent the spread? One is socially distancing. Dr. Torres, who's our Chief Medical Officer, shared this slide recently, has shared it in a couple of community updates, and I think it really says a lot. It shows how just a couple of people, by making certain choices, whether it's avoiding to go to a social event or staying home or wearing a mask, what a big impact that can have to help prevent the spread. So you can see how that drastically reduces it by just the power of choice. By 1, 2, 3, 4 people can truly make a big difference. So continuing to social distance, wearing a mask. I want to thank our county. Commissioner Oakley is here. Big thanks to our counties that have been continuing to vet the masking ordinances. Truly, from a clinical perspective, we do see that making a difference. That is what has helped our numbers go down from where they were in mid-July to today. So continuing to make that choice to wear a mask does help. If you are personally experiencing symptoms, quarantine, get tested. There's a number of different locations to get tested. Within AdventHealth, our Centric Care locations offer a very quick turnaround test. It's about 20 minutes. My husband had it done recently. It was negative, thank goodness. He hates the deep nasal swab, and he said it was painless. That one's not quite as deep. So we've got a number of different options. Obviously, our emergency rooms as well as some of our primary care sites. But if you're concerned and think you may have symptoms, quarantine, get tested, and then get a flu shot. That's a question that I've gotten a lot as well. In fact, this year, we typically require all of our clinical team members to get their flu shot or wear a mask if they're not getting the flu shot, which we're all wearing masks anyway right now. But this year, to encourage all of our team, AdventHealth is asking all of our team members, including those working remotely, we do have a number working remotely, to get their flu shot to help prevent that spread and flu-like symptoms from COVID as well. So it's just as important this year as any year to get your flu shot. I got mine yesterday. My arm is a little sore, but it wasn't too bad. The other thing that I would encourage is your healthcare is essential. We are seeing across the country in March and in April, when COVID was first hitting, emergency rooms across the country saw a huge reduction, 30 to 40% in the number of heart attacks and strokes that were coming to ERs. And the truth is, people were still having the same amount of heart attacks and strokes, but they were waiting and not coming to the ER. And we've seen that since in the summer months, people that are coming in are having more serious issues clinically because they've held off or delayed on that care. And especially in things as time sensitive as a heart attack or a stroke, time is muscle. And if you're experiencing any of those symptoms, you want to get into the hospital. We want to assure people that we are a safe place to be. We have a number of precautions in place to keep you safe, and we don't want you to delay that care. October is also Breast Cancer Awareness Month, so it's a great reminder for all the women here and women in your lives, men, to remind them to schedule their mammograms. Get your routine screenings. Don't put off your primary care visits, routine screenings, colonoscopies. My concern long-term with COVID is not just the immediate impact of COVID, but what is going to be the impact of the health of folks around our country and around the world over the next few years, when we may have started to put off that routine care because we're afraid to go be seen. So we want to encourage people not to put that off. There's a few things that we have in place to try to help with that. We are offering telehealth. So a number of our physician offices, primary care, even specialists are offering telehealth visits. That is very helpful. I've done some myself. It's actually a great thing. And they'll help determine if you need to be seen physically in the office. They'll make sure you get seen physically in the office. But there are a number of things that you can do now through telehealth, which is a great option and a lot more convenient. We also have a service throughout all of our West Florida hospitals called InQuicker. This is a free scheduling service. You can go onto a website. If you're having truly time-sensitive issues that could be a heart attack or stroke, it won't let you schedule because, again, time is muscle, and it's not going to say, it's 9:30. I'd like to go in at 1:45. No, they're going to say, go to the ER right now. But if you're having something that's not truly that time sensitive, but it is emergent, you can schedule an appointment to go into the ER. You don't have to sit in the waiting room with other people. We'll have a time slot scheduled for you. You can come straight back. And that's a free scheduling service, if you will, for all of our ERs in West Florida. Here's some other things as we look to the long-term impact COVID is going to have on healthcare that it's having now and could have going forward. We are seeing, as I shared, some fear-driven consumer behavior changes. And we're not the only industry to experience that. But again, what will the long-term impact be if people are delaying care that they really do need to get? With the impact to the economy and the number of jobs that are being lost, we're watching for that loss of employer-sponsored insurance. And what impact will that have in the coming 12 to 24 to 36 months if people don't have the insurance coverage to be able to get, again, some of those preventative services? There is an increase in telehealth, which is not a bad thing. That's actually one of the really great things that has come out of COVID. A number of the guidelines and allowances that came out from CMS, Center for Medicare and Medicaid Services, are allowing more telehealth than we were able to do before and to be able to get reimbursed for that. I hope that's something that stays out of COVID. That's really, truly a positive thing in healthcare that could increase access for a number of folks that sometimes can't physically get into the hospital or physically get to their physician offices. There have been a number of disruptions in our supply chain. We will never go back to operating our supply chain the way we did before COVID. We have much more in inventory across our system today than we did before, and that will stay. I don't know that it'll stay to the full level we have today, but we won't go back to more of a just-in-time delivery system. We're going to continue to have more available for supply chain. AdventHealth has also worked in different partnerships now with domestically produced PPE and things. So it really is having a dramatic, but I think positive in the long-term impact on how we're handling our supply chain and system. There have been a number of financial losses, and I'm very thankful for the federal CARES dollars that our hospitals have received. That truly has been a big help. As I shared earlier, we went from middle of March to about the middle of May, where we were not allowed to do any elective surgeries or procedures. For our hospitals, one of the biggest financial generators is surgeries. And when we had a number of those surgeries cut, a number of emergency department visits were reduced because people were afraid to come to the hospital, that has had a significant financial impact on all of our hospitals throughout AdventHealth. And the long-term impact of that is it reduces our capital that we're able to invest back into our hospitals because we are a nonprofit healthcare system. Any earnings that we generate get invested right back into the hospital. It helps us purchase equipment like hospital beds, new technology, helps us build and expand things like new operating rooms to serve a growing community. And so that is something that we're struggling with right now is our financial impact due to COVID is going to restrict the amount of capital we have available in these coming years. There have been disruptions to our healthcare workforce. We've had to spend quite a bit in our peak periods on getting more agency staff, which are more expensive. We saw, sadly, with both supply chain as well as with staffing, that there were some that took advantage, and quickly the prices that we used to pay for certain products and certain staffing were tripled, quadrupled, sometimes even higher. Part of it was because the demand was just so much more than the supply. But we're also seeing that some of our staff and or some physicians are saying, you know, I'm pretty close to retirement age. I may just go ahead and retire now rather than having to deal with this. And so there's disruptions to the workforce that we are working through and figuring out how to manage and train new nurses coming out of their programs to get them up to speed. Last I listed here for physicians, they've had some financial hardships as well. And so we're monitoring that to see what impact that has over the coming years. But certainly a lot that COVID has done, not just in the immediate, but that we're looking ahead for the next few years. Not all bad. Some of it's good, again, with telehealth and supply chain lessons learned, but definitely changes. We won't go back to the way that we were before. So what's to come? We are, again, we're here. We're here to care for you and your family members. I wish Dr. Torres was here. I know I've got some great comments about him and different community presentations that he's done. If you ever have questions clinically, he's a great one. He can be available to speak to you or groups that you have and talk about what we're doing clinically to care for patients. But we are continuing to learn as an organization, to learn best practices, to work together as a team, and we're going to be here to help take care of you and our community, whether it's COVID or anything else. And again, I would encourage you and your family members, don't put your health care on hold. We want to continue to be here and not see your long-term health suffer because of not getting some of the screenings or preventative care that you may need today.